This is an alliance of the Beechwood, Euclid, Heights, Hillcrest, Mayfield, Solon, and the Warrensville Heights Area Chambers of Commerce. So welcome everybody. Those are all the partners of our 6 chambers. So thank you to everybody who's been a part of that. If there's anybody here that's affiliated with those companies, a special thank you. Peter Young is a senior healthcare services consultant at Paramount Preferred Solutions with more than 18 years of experience in the healthcare consulting field. He's also a board member of the Beechwood Chamber. PPS is a Northern Ohio owned and operated company with offices in Cleveland, Toledo, Columbus, and Wheeling, West Virginia. And since 2008, PPS has been endorsed by NOAC, which is the Northern Ohio Area Chambers of Commerce, to provide trusted consulting and administrative services for employee benefit programs, including BWC, FMLA, UC, wellness, rehab, EAPs, safety, teleadvocacy, and now COVID. And today, Peter is going to give us the key benefits for self-employed professionals and independent contractors. So, Peter, I turn it over to you. Thank you.
Morning, everybody. Much of what I'm going to talk about is not stuff that I've read from the internet. It is information coming straight from United States, Ohio, or local laws or benefit programs, or just the benefits that are offered to employees either on mandatory basis or voluntary basis. In alphabetical order, so there's a lot to talk about in the Bureau of Workers' Compensation system. Emerging liability concerns. Jennifer, welcome your input when we get to that section about reopening and staying open. A U.S. relatively new United States Act out of the Department of Labor. It's called the Family First Coronavirus Act, Response Act. It is for employers with less than 500 employees. So even if you're a sole proprietor, there is value to look at this program. The state of Ohio is, we'll get to the Bureau of Workers' Comp in a minute, but they have a real lot of money in grant programs to offer to employers who have a workers' comp policy. And we'll get into that. These are monies that if you qualify for it and can benefit from it, please take advantage of these. We'll get into that. And then last but not least, we all hear about and read about and maybe have been using telemedicine or telehealth services, either before COVID or during COVID. There's more to it than that. And this will be one of our few plugs, but we have scoured the marketplace to find the best services. This is more of a concierge program that includes telemedicine. It's called a teleadvocacy program. And the other cool thing about it is, besides being a non-insurance program, it is also available to individuals who may or may not have health insurance. And so we'll talk about all of this as we go along. So let's start into the workers' comp space. And before I go anywhere, just in case some of you work at organizations who already have a workers' comp policy, and for self-employed people, it is voluntary to have it. But if you already have a policy, just know that the state of Ohio is now looking at doing another round of $1.5 billion refunds. They just announced it the other day. They are voting on it in the fairly near future. For those of you who have a workers' comp policy, 4 of the last 5 years, the Bureau has given back over $1 billion each year in refunds to employers because they can afford to do it. Our state system in workers' comp is a state-run insurance organization. There are only 4 states in the country that are like this. That has its pluses and minuses, but right now, because of the stock market, they keep getting great returns on their investment, and they keep giving money back. This past fall, a year ago, they did a $1 billion return. This past spring, they did, and now they're talking about doing it again. They hover between 11 and 12 billion with a B dollars of our money under management. Again, they are an insurance organization. So they are a carrier as they collect premiums and pay out for medical bills and compensation. They are just flush with cash. One of the reasons they can offer grant money, but that helps. But this infusion of money has really helped a lot of businesses, small, medium, and large, with cash flow, among other things. And they are now talking about if you have had a policy in Bureau year 2019, and a Bureau year for private industry runs July 1 to June 30. So if you had if you had a workers' comp policy from July 1 of 19 to June 30 of 2020, you probably received 100% of your premium back in the spring, and now they're going to talk about doing it again this fall. So if you subtract 1 billion from 12 billion, you're still left with 11, and which means they're going to keep doing this. So when we talk about BWC insurance here for self-employed individuals, we'll talk about the cost of it in a second. Just know what they're basically doing, and probably going to be doing for the next 4 or 5 years, is basically making workers' comp in Ohio free. So get in on this if it makes sense for you as an individual or as a small business to have a policy. I'll show you why I think it makes sense in a minute. But also know that the way the game is being played is in our favor here in Ohio, and you might just find the cost of insurance to be pretty close to zero. The benefits of insurance, let's talk about.
Hey, Peter, quick question.
Yeah. Yes.
Do employers have to do anything to get that refund, or is it automatic? Do they have to apply? Do they have to push a button, or is this automatic?
Is that Jennifer?
Yes.
Yeah. So if you have a policy and you've kept it current and you're paying your bills, meaning premiums, and there's a little thing called a true-up, which is something, if you have a policy or somebody at your business knows what this is, but it just means you're making sure that you're paying all of your bills on time, and if you do, it is automatic. They have either been giving refund checks back or paying premiums out of the refunds that people get. It's all over the place. One of the reasons, by the way, we are a third-party administrator, a TPA, so we monitor all this stuff if you are a client of ours. Another little shameless plug here, we do this work for 126 chambers as endorsed by the chamber above all the chambers called NOAC, the Northern Ohio Area Chambers of Commerce. We've been endorsed with them, as Sheila mentioned, since 2008. We'll help you monitor this if you work with us. I believe most of the 6 chambers that are involved in ECCA are also clients of ours, and we are now members, by the way, of 3 of the chambers, maybe even 4 to be soon. So we believe in what you're doing and work with you, and because we live in the chambers themselves. I happen to be a board member, by the way, of Beechwood. So leave all that aside, but that hopefully answers the question. You get it automatically if you have a policy. So as a self-employed, sole proprietor individuals, you don't have to have workers' comp insurance. But I'll pose some questions on this slide to you. What happens if you have a work-related accident or COVID-related illness or a disability situation, such as you contract carpal tunnel syndrome because you're sitting at home working and over time are straining your wrists because you don't have a great ergonomically designed workspace. Matt, there is somebody trying to get in at the waiting room, just in the background there.
I don't see anybody on mine. Sorry,
Somebody's supposed to get admitted.
Okay.
Anyway, so does your health insurance cover medical bills related to a work-related accident or illness or disability? In many cases, I don't sell health insurance. I think there are some people on the call here that may offer health insurance, but my working with most businesses that I know, health insurance probably doesn't or may not cover this. It also may not cover the specialists and rehab services post the injury or illness. And then big one here is what happens to your business if you can't work or earn an income because you are laid up. Typical health insurance coverage topics. If you have health insurance, you're probably paying a monthly premium. You probably have a deductible to be met before your insurance even kicks in. You may have co-pays, meaning $25 for an office visit or $10 per prescription. Co-insurance is if a claim occurs up until when your deductible is met, you're going to pay a piece of that. There are out-of-pocket maximums every year before you get to fully paid insurance use. And then your income replacement in health insurance is zero. That's why you have sick time and PTO and things like that. Well, let's flip to what workers' comp looks like. The minimum, not monthly, but annual premium could be as low as $120 a year for a very small business, such as some of you. It can go up from there, certainly, but that's a minimum for a whole year, not a month. No deductibles, no co-pays, no co-insurance, no out-of-pocket maximums. And here's the big one. There is a way to receive income replacements called temporary total or other things like that that will actually provide you income until you are fully healthy and back to work. That's big. I have had contractor clients who went through $40,000 of medical for surgeries and couldn't work for 4 months, and this issue right there saved their business, let alone the cost of medical. Because again, in workers' comp, medical is paid by the state of Ohio. The claims are managed by the state of Ohio, an organization called a managed care organization. They pay the bills. They manage the claim paperwork. They help you get the claim going. So the whole system is set up to make it easy for any size business. But if you're really small and your time is valuable, that may be really helpful. Any questions about that? It's really quite a value. And again, if you have a policy, you may be qualifying next year for one of these big refunds and the years that follow, because that's what we're being told. The Bureau with this $12 billion really doesn't want to keep all that. They probably won't be allowed to keep all that. If they get to $4 or $5 billion more in management than they really need to run a conservative organization, they're happy to do that. Well, that means 4, 5, 6 of the next years, we could be looking at full premium replacement refunds. So just another reason to take a look at it. If you had an injury, this is a little bit of dated research from the Bureau, and this is a manufacturing example, but they're not very different. This was about 2016 when they last put this data out. The average cost of a claim in that industry was, you can read it here, $5,550. Only about 900 of it was on average for medical. Look at the compensation cost, $32,000 for the average claimant that needed to be off work because of their injuries. I can guarantee you for just about every manufacturer of this size, and that adds up to, let's just say, $33,000 or $4,000. That cost was way more than their premiums that they were paying, and also probably knocked them out of some other kinds of discount programs that they were eligible for. That's a whopping lot of money. And if you don't have a workers' comp policy, those kind of costs may not be covered by your health insurance and will be coming right out of your pocket. So just an FYI about how valuable this is. God forbid something happens to you. And car accidents, slips and falls. We're seeing claims right now for people tripping over their laptop cords in their home. I mean, all this, and we all know medical costs are not inexpensive. But the big one there, again, is compensation. Just some stats, thought for fun here. When somebody is really badly injured and they're off about a year, only about 20% of people ever return to full duty work. RTW means return to work. These are some staggering statistics. These are nationwide statistics, not just Ohio, but the return to work aspect of major injuries or disabilities is really hard for the individual, but could be really difficult cost-wise for a business. If you decide to apply for workers' comp coverage, certainly feel free to reach out to me for help. We do what we've promised all of the chambers is free consulting to somebody that's trying to figure out how to get started, how to do the right things, how to manage their policies, etc. There is the website on this slide. This actually was the homepage of the Bureau up until last Friday, and now all of a sudden they have a brand new homepage. But it's pretty easy to find the click through, and I put an arrow on it to apply for coverage. Then you follow the process through, and you get a policy, and then I would be happy to give you some help at that point, or as you try to apply to help make sure that you get it started correctly. There's going to be some things that'll happen once you do apply that you'll want to probably get some good advice on. My advice is free. If you are self-employed, you will be selecting elective coverage. It's not any different from anybody else, but if you don't have any employees, it is not something that's mandatory that you have. This is, again, off the workers' comp site. You can get some examples there of the types of employers that can choose electively to get coverage. Right below the bullet points, it says, remember, if you choose not to cover yourself and you are injured at work, BWC will not provide coverage, and other insurance may not cover your work-related disabilities or medical bills. So that's right straight from the state of Ohio. Anybody with any questions about that? Please really think about it. Or if you have clients that are small individual type businesses, they don't have insurance, there's lots of reasons and more coming why you might want to take a look at this. All right, so now I'm going to jump into and away from that just to get into what's going on in the world from the way we see it. One of the big things I was chatting with Jennifer, who is an attorney, about what we're seeing in the workplace. And one of the key things to know is that when you are teleworking or working from home, and if you're self-employed, maybe that is your sole workplace, the home is a workplace. For those of you who have employees who have either elected or chosen or been allowed to work from home, home is a workplace that is different from an office. At an office, it's probably pretty standard procedure right now to be doing all the things that we're supposed to be doing, practicing smart sanitization, disinfecting, wearing masking, doing social distancing at the office. Well, at home, you probably have some of the same kinds of issues. At home, you're interacting with your family. At home, you are also going from home to the grocery store or other places. Are you doing the smart things that we're asked to do? Is everybody around you doing the smart things that they're supposed to do? So that's a big issue because you're dragging your home world into your workspace. You don't have a choice because they're interacting with each other. And we'll talk about some of what that means from a liability or legal perspective in a moment. Ergonomics. Do you have a workspace that has a really good chair that protects your back? Do you have a work desk that protects your wrists from strains? Do you have a good monitor to help you with your eyesight as you are working day to day? Just some things to think about. I mentioned tripping over laptop cords. That's going on. So safety, you get good training at an office. Well, smart safety practices at home are important. Winter's coming, unfortunately, so tripping and falling and on ice, etc. If you drive eventually to clients, that's probably a work-related situation. You have to take care of yourself from a work perspective, and if home is your workplace, then safety at home is important there. There's lots of training that you can get. By the way, our wonderful Ohio workers' comp system has a ton of free training classes, videos, services that you can take advantage of if you had a workers' comp policy. Training, if you have safety practices, are you making sure that you're following those? If you have employees, are they being trained for work at home correctly? Data security. So probably speaks for itself, but I'm in the healthcare industry. We deal with personal health information and financial data of our clients all the time. Working from home is your data system protecting that data, encryption and security software. Is that as strong as it is at home as it might be at work? And then I added something new. I've been reading a little bit about what is now being called work from home fatigue. Certainly by now the novelty of working from home is worn off. And it's best described as the deterioration, I'm reading here, of satisfaction and productivity of employees, which can be caused by everyday monotony, working from home, not having necessarily the right resources in place, not having work routines that are the same as every day at work, missing working with your colleagues, having to interact with family at home, missing having coworkers to be able to easily interact with. This is causing new stresses and is now has a term called work from home fatigue. So that's going on. Emerging liability concerns. I'm not an attorney. I've been told by several attorneys that it is a matter not of if, but when lawsuits related to COVID in the workplace will begin. There are things called liability waivers that, as you may or may not step into a business situation, you might be required before you get service to sign one of these. I understand they may or may not be enforceable, but that's going on out there. So that's a decision to be made, whether or not you need to sign one of these if you're even asked. A legal term called derivative exposures, meaning somebody, you're working from home and you have family, friends, customers, visitors, repair people, vendors. They could be infecting you or vice versa. Ohio workers' comp is no-fault insurance, meaning that employees cannot sue their employer for things. They are taken care of through the benefits that they receive. But I understand there are, in other states more maybe than Ohio, public nuisance cases being filed to get around this no-fault situation in states like Ohio. Negligence and wrongful death cases are being filed based on the kinds of issues we're talking about with COVID and people getting infected. A big one, by the way, COVID infections can become workers' comp claims. There are now about 1,000 claims have been filed in the workers' comp space here in Ohio based on an employee alleging that they were infected at work. For what we know as a TPA, the burden of proof is on the employee to prove that it happened at work. There's a lot of evidence that must be submitted that in fact you were infected at work versus another place, but COVID claims can become allowed claims in the workers' comp space. Does your liability insurance cover virus exposures? I've been told by the insurance community that it may not be out of the box. You may have to request it or add it as a rider. It's not just automatically there. That may cover a lot of the issues if you have liability insurance for your business for virus exposures, but just be aware that may be something you want to look into with your insurance agent. An example of a crisis situation that I had with a client, a home health care client, had a employee working at patient sites, this was way back in April, who found out that they had been exposed through a patient to COVID, and came back to work not knowing it, worked within the home health care company, exposed all of the employees, and my client called me in a panic saying, and this is way back in April, what the heck do I do about that? Well, we talked about the medical field, but he was very concerned about the exposure in the media to his business if in fact his employee got sick and infected all the other employees and maybe infected other clients, and asked me to, what the heck do I do? Well, I helped him connect with a crisis management company to try to control the potential media that would start talking about the business in the media, and the XYZ company had an exposure, and try to control how the media situation worked. Thankfully, the employee did not get sick and nothing happened with it, but this is an area to think about for your business. Being named on TV for having a breakout in your facilities may not be what you want to do, or you may want to control how that works. So these are all things that we can connect with and help you with. Yep.
This is Jennifer. Can I just chime in for a second on liability waivers?
Yep.
So one thing I want to mention, Peter did say that these liability waivers that some stores and businesses are having their customers sign may or may not be enforceable. Okay. I think it's going to be questionable if they're enforceable, but that's really for the personal injury attorneys out there. But what I do want to mention is for people on the line who have employees, you cannot ask your employees to sign a waiver. So just because you're putting one out there for your clients and your customers, if you put one in front of your employees, it is automatically void under the workers' comp law. So workers' comp, you cannot waive your rights to workers' comp, and an employer that tries to get an employee to waive their rights to workers' comp can get in whole loads of trouble down the line with BWC. So please do not ask your employees to sign any type of waiver.
Did I do a reasonable job on the rest of that, Jennifer?
Yes, I thought it was a fabulous job.
Okay, good.
Especially, I like how you have document in red and in big. Thank you for that. I love documentation.
Yeah, that is where on this slide, among other things, please document anything that happens with your employees. Obviously, do things on a consistent manner so that everybody gets treated the same. But anything that's going on with this, work with your attorneys, work with your workers' comp companies like us, and make sure you've documented what's happened. It may become important if somebody creates a claim.
Yeah. There was a question in the chat.
Yes.
About if an employee tests positive. It initially said unemployment, but Faith corrected herself and she asked if somebody could make a workers' comp claim out of that. So yes, they can. That's a bigger discussion than we have time for, but we can certainly talk about that offline. So
can you hear me?
Yep. Hello.
Hey, it's Brian. I just want to also mention that not only documentation for your employees, but yourself, if you're self-employed or whatnot, if you ever have to make a workers' comp claim for yourself, you're going to have to prove it happened at the workplace. And it's even harder for you to get distance and be objective when it's happening to you and your family and your own life. So make sure you please take careful notes about why you claim it happened to yourself if you're going to end up making a claim on yourself as a self-employed person.
And as I mentioned, right now in the workers' comp space, the burden of proof is on the employee, not the employer, to make and state that case. There is a federal organization called the Occupational Safe and Health Administration, OSHA. Workers' comp claims can become what are called OSHA recordables. And an OSHA recordable could easily be something that they will audit or worse. There are COVID claims in the OSHA world now that are creating fines. The highest one I've heard in Ohio is $40,000. What that means is the OSHA came in and determined that the workplace was not following smart practices for protecting their employees. An employee apparently got sick, called them out on it. OSHA came in and has fined them significant money. So we'll leave that there. Accommodating disabilities. So I've had a couple clients call me about having employees who have COPD, allergies, or are asthma sufferers and are having trouble wearing masks at work. That is something those are potentially disabilities. They need to be accommodated the way the world works. And but that is introducing risk because somebody who's not wearing a mask may not be as able to control what they are bringing to their office or bringing in from home. Or if you're working from home and you have an allergy or a COPD or asthma, again, you could be creating an infection situation, and there are lots of ways to handle it. But wearing a mask at work may actually be a problem for some people. And then what about employees who refuse to go back to work? They need to show good cause to currently be able to continue their unemployment benefits. Back in June, Governor DeWine signed an order saying there are 5 good cause examples specified to allow continuation of unemployment benefits. Won't have time to go through it, but just so you know, quitting or declining work solely for childcare issues does not qualify as one of these 5 good cause reasons. We do a lot in the unemployment space, and we've begun to get lots of questions about this. Another way to handle childcare, which is certainly beginning to be right back in center stage in all of our worlds, those of us who have kids, is safety with our kids going back to school, safety certainly with our kids' health and what they may bring back to us. And there has been a law on the federal law, Department of Labor law on the books since April 1st called the Family First Coronavirus Response Act. This is actually the poster. If you have a business with employees or if you want to look into this, I can send this to you. You can find it at the Department of Labor. But there are paid leave options coming out of this Family First Act to help with leave entitlements. There is COVID sick leave for somebody that actually has it or has contracted it or is being quarantined. And there is also family medical leave that's now available to take care of child care. Unlike the FMLA Act, Family Medical Leave Act, that requires that an employer have at least 50 employees. This is a covered employer is considered an employer who has 500 or less employees. There are exceptions. So that means even if you're self-employed, you may be able to take advantage of this, God forbid, if you get sick or you can see the 6 reasons in the middle of this. It's really small. You can look it up or I can send it to you. Again, somebody that you take care of or you yourself get sick or have symptoms, or if you're taking care of children, you may qualify for paid leave. So This is a big program that's, as I say, brand new at the moment. It's only going to be available through the end of December. We'll see if that gets extended. If you want to get into the weeds of this, there is a Department of Labor document that's an FAQ document. There are now 96 total question and answers. It's about 60 pages. I know Jennifer, as an attorney, is certainly up to speed on this. We're pretty good with this ourselves. Also, here are just some areas to know about how they work and what you need to do for record keeping, because, by the way, the cost of this, you pay the person. You may have a tax deductibility way to pay the business back for offering this. So now you also need to look at IRS with this. So work with experts if you are concerned about doing it right or having the time to figure it out. What are we doing on time here? We're getting there. Okay, the grant programs. Ohio is, I think, way ahead of most states and fairly unique in offering this kind of money, again, because it's coming out of our workers' comp space, and there are very few states that have a state-run insurance organization. But here are some ideas. There's money to buy smart safety-related equipment or materials or chairs maybe, or better workspaces. It's a lot of money. Transitional work probably isn't going to work for most of businesses here because you have to have 11 employees to take advantage of the grant, but bringing people back to work or getting yourself back to work is really important if you had an accident, illness, or disability. There is wellness money here in Ohio. There's individuals can take advantage of a workplace wellness, not a grant, but a funding source at the state of Ohio. If you have employees, there's a grant program for it. Probably pretty darn unique from what I've seen. We're pretty up to speed on this. If you have questions or want to look into it more, feel free to contact us. The state workers' comp system has a drug-free safety program and a grant to help fund it. And then there's there are a number of very individualized grant programs. You can see a couple of them here that may be money that can help a business create benefits or create better safety practices. Here is a little bit of a look at these off the workers' comp space. Again, these are the actual documents that you could find from them. And then I'm going to spend the last few minutes here talking about teleadvocacy. So when do we all get sick? And when I say sick, I'm talking about the 80% of the things that make us sick. These are non-emergency, typical things that happen to all of us at some point where we get sick on a temporary basis and eventually get healthy. These are all typical things, COVID being one of them, hopefully. Yeah, I say temporary. Here was just some goofy examples out of my life. When I had young kids, they never got sick at a convenient time. It was only in the mornings, waking us up, getting pink eye or strep throat or earaches, when no simple place to go get treatment or prescriptions is available. If you have an hourly employee who gets sick at work, what happens? Or if you do, as an individual self-employed person, do you have the time to take off to go get treatment or seek treatment? If you have hourly employees, they have a choice to make whether they earn a living or stop working to go get treatment. You've lost a productive worker. If you're self-employed and you can't work, you're losing out. Time is money. I still have elderly parents, and they still forget to fill their prescriptions, and guess who they call while I'm trying to get something done at work. My spouse got an infection while we were on vacation. Now where do you go? What do you do? I strained my back on a business trip. I was nowhere near where I could do something about it. We'll leave that there. And then I had a child get a rash swimming in a lake on July 4 way back in the day. And again, nothing convenient is open to go help her. Sorry for the phone in the background, folks. Here's some recent costs here in Northeast Ohio for the cost of healthcare. Telehealth visits, pretty inexpensive if you even have a cost. Many carriers right now are not charging people who have health insurance to take advantage of a telehealth visit. This was really important back a couple months ago when doctors, we were not going in to see our physicians or our primary care people. Retail clinics, urgent care centers, those are some of your other options to seek treatment versus emergency care, which is certainly out of sight in terms of cost and maybe overkill for the having strep throat, but it may be the only thing open. And oh, by the way, when you're there with 100 people that you don't know, that could create some concerns about being safe and smart health practices during COVID. Seeing your primary care physician, mine right now is about 30 days out from getting an appointment. By that time, I'm usually already cured. Urgent care centers, a big place to go, are only open at limited hours. And again, these are some areas where you go to seek treatment. So again, we all know that telehealth is out there. Here's just some ideas about, our alternatives for non-emergency care and how people are saying, why we use telemedicine or should be using telemedicine in this country more than we maybe are. Now, I think COVID may be changing that. A big one on here is the fourth bullet. A lot of people maybe don't have a regular primary care physician. Millennials, many do not. They're pretty safe in thinking, I'm not going to get sick. Well, that may be changing in the way the world is going with the way COVID exposures are now coming into younger people. A big thing in all of this is that there are about 40 million Americans, I think, the latest statistics I saw, who are out of work, may not have health insurance anymore. So what do? Well, teleadvocacy is certainly a big option. And telemedicine we know about. So some thoughts: juggling jobs, taking care of elderly, kids, and having elderly parents. Those of us that are in that situation are called the sandwich generation. What do we do to manage our time and take care of all of the people that depend on us? Where do we find trustable health information quickly online? Is that really trustable? Is that really good advice? And then if we're stressed and on a limited budget, that adds to the stress of trying to take care of the people that, again, depend on us. So telehealth is kind of a given out there, except if you don't have health insurance. It may not be. The services that we offer, again, are non-insurance and don't compete. If you have Anthem insurance through your chamber, great. But if you don't have health insurance or just lost it, this may be an alternative. Most of the rest of these on here are really some of the more advocacy programs that are offered. So you can talk to doctors and nurses online 24/7 to seek treatment advice and options. You can get second opinions this way because once you leave your doctor's office and go home and then some things might be occurring or you might have some side effects, good luck getting another appointment or trying to get them on the phone. Well, you can use these services to talk to experts who can give you advice. If you're using telehealth, you can get prescriptions. Well, the advocacy program that we have offers discounts. And most prescriptions, 60,000 pharmacies nationwide. I use this and I have health insurance, so I go into my pharmacy when I have a prescription and say, here's my medical insurance card and here's my teleadvocacy card. Tell me which one will cost me the least. Caregiver support. There's a lot of work-life balances programs that are available within this particular service that we have. And then dental and vision services and wearables, there's discounts off of that. This is a very affordable approach and may be an alternative to what you have through your carrier because your carrier may not offer these other concierge type of services. Or if you don't have health insurance or might want to find ways to help your family, because these are family plans. So there's lots of ways to pay for this. Employer paid, employee paid. There's COVID applications within it. As I mentioned, as individuals, you can use this. As a family plan, you can do this. So the tele-advocacy piece is for people who do not have health insurance, and includes telemedicine. And if you have health insurance but want these add-on services, you can get just the plain advocacy plan part of it. So I think I made it. It's 9:58. I promised an hour. Do we have questions? I think that this presentation has been recorded as well. You can contact me or the chambers to get the PowerPoint if you want it for backup or just to look at it again. But if you have any questions, I'm ready. And if not, I hope this was a good use of an hour of your time, and I appreciate your attending. I hope this gave you some food for thought or things to help your businesses save time, money, and control risk. Sheila? Yes.
That's Jennifer. If there aren't any questions, can I just give like one little war story to show why even solos should have workers' comp coverage?
Please.
Okay, a lot of sole proprietors rely on independent contractors, and sometimes people are properly classified, sometimes they aren't. A number of years ago, I had a client referred to me, and it was way after the claim happened, but he was a sole proprietor. He had brought on an independent contractor, and the second day of that person's work, they had an accident at a client's. These guys were consultants, so they were on premises at clients' places. He had an accident at the client's, and he broke his leg. And the sole proprietor did not have BWC coverage. BWC, the independent contractor, then decided he wasn't an independent contractor. He decided he was an employee. He filed for workers' comp coverage. And because the employer didn't have any coverage for the business whatsoever, they were non-compliant. It was out of pocket, dollar for dollar, for every penny of the medical treatment and every penny of lost wages. And because this guy got to me after all the appeals periods were way long gone, there was absolutely nothing I could do about it. All I could do was manage the claim. But at least if you're a solo, not only do you give yourself the protection, but if you work with independent contractors and then somehow somebody says, no, they're not an IC, they're actually an employee, at least you've got coverage for the business. So you're protected at least to some extent on cases like that. This guy was out of pocket, I don't know, 30, 40 grand, something like that. It was ridiculous. So highly, highly recommend solos do this, especially if you work with, if you have independent contractors that work for you.
Great war story. and so true.
Yeah.
Again, folks, I'm looking at some of the chat areas. I apologize if you would like to get a copy of this from me. Could you just email me or call me? My cell phone is 216-402-4006. I'll be happy to help you in any way I can. That's 216-402-4006. Michelle, I see that I've written your number down, Michelle, and I will try to get back to you this morning. Sheila, any last words from you?
No, thank you. That was great information, and I appreciate it. Thank you, everyone, for taking time to join with us today. And I believe that Matt will be recording this, so we will have the presentation link if anyone needs to go back and rewatch.
Yep, absolutely.
And as I said, you're welcome to contact me or your chamber to get a hold of the PowerPoint.
All right.
All right. Thanks, folks.